Let's get to Marty Williams. Marty Williams is the Republican candidate for Congress in the 3rd District. He'll be opposing Bobby Scott. That'll be determined on November 8th. Marty Williams, good to have you with us, Marty.
Morning, John. Thank you for having me.
Okay, what's on your mind?
Well, I listened to the speeches. I've listened to the great interview you had with Congressman Scott, and some of the things I have to disagree with. I just don't believe that Congressman Scott is right. I'm following you, John. Let's face it, Donald Trump is going to sweep the nation. It's going to be a great victory. And I think
so. I think so, Marty. I don't even think it's going to be close. But, what do you think Clinton has to do tonight in her speech, Marty?
I'm not sure there's a lot she can do. There's so much anger in this country. There's so much concern about personal safety and the safety of our country. I'm not sure that she can recover from the bad policy she's made in the past.
Mm-hmm. Mm-hmm. All right. You just heard our segment with Bobby Scott. Marty, what were some of the things that he said that you specifically take exception to?
Well, first of all, is his belief that Hillary is going to win. I just don't buy it at all. It's just not going to work. And let me say this: the first time Mr. Scott and I are going to be together will be August the 8th at Isle of Wight Civic Association. We'll be meeting on Centura Way, I believe, is its location. It's going to be a public forum. He and I will both be on the same stage. We will not have a debate. It'll be a question and answer period from the citizens of Isle of Wight. And I look forward to meeting Congressman Scott again. I met him one time previously, and just sharing our views with the people who are going to be there. And I think they'll see that there are a lot of differences in what we're doing. He has a way of he has his style of wanting to govern, and his record will show that in 24 years. And I believe his style is a failing style. It has not worked in the past. There are problems that have arisen. He has not tried to fix those problems. And I'm going to offer a new way. I'm going to offer a way for people to actually have a positive voice. They're going to have representation. I'm going to offer solutions. And so far, the solutions that Congressman Scott has come up with have not worked. They've been the establishment solutions, and they have not worked. So I'm looking forward to sharing those solutions with everybody.
All right, so give me an example. Like, let's get to the minimum wage. Like, he's for an increase in the minimum wage to $15. Trump yesterday saying that he was in favor of increasing it to $10 federally and then leaving it up to the states. What say Marty Williams, and why?
The states should be establishing the state minimum wage. As far as the federal minimum wage, I do believe there's a time now for some dialogue on it. I think it's to be a good discussion on it. But remember one thing. When the minimum wage goes up, the price of everything else goes up. Happy Meal is no longer $1. It's going to be $1.50. A gallon of milk is going to cost more. It's going to cost more to live. And there's a fine balancing act, but I think it's something that the economists can sit down on and work together. We can get our experts to work together, but I don't think we should mandate a federal minimum wage to the same level as the states, because the states know how to govern themselves. They're the best judges of what they need and how they should govern the people that live there.
All right, so give me an issue or two that you're really opposite with Bobby Scott. Here's an example, and I don't really have a rebuttal for this. He's like, well, you guys want to get rid of Obamacare, which is a tax. We all agree with that. And you want to replace it with something. Replace it with what? What's the alternative?
The alternative, first of all, is something that everyone understands. Let's face it, the Affordable Care Act, no one read it, including Congressman Scott. No one read that bill before it was voted on, except the people who wrote it. And if you remember, they had kind of a laugh session several years ago where they were caught in a situation where they were laughing, knowing that people voted on it, not even knowing what they voted on, how much it would hurt the American public. Remember the promises we got? Keep your doctors? Guess what? That didn't work. Premiums are going up. The level of service has gone down. We've got to get a health care system which is going to work for everyone, treat everyone fair and equitably, and not have just a few people paying for all of the people to have health care. The health care rolls have really not increased that much. There are still people without health care in this country. And the whole system's got to be revamped, refixed, and put citizen input into it so we can all take a part in our health care system.
Okay, so there's no question that you got all these people that don't have care. They fall through the cracks. So, again, I mean, what would be the alternative to this? I mean, do we turn it into like automobile insurance where you just open it up and you open the competition up and you open state lines? I mean, I remember when I was a younger man buying auto insurance Marty, it was very expensive, and I lived in New Jersey, and that was it. You had New Jersey companies, you couldn't go out. Then when the whole thing got deregulated and opened up, everybody started competing for everybody's business, and auto insurance went down. Why couldn't we do the same thing in the health industry?
I would have no problem with that. The marketplace will react the way citizens want it to if it's just opened up without too many government regulations. Right now, we're over-regulated on everything that we try to do. There's too many regulations running our lives from the federal government. We need to have, if you want to call it open marketplace, so be it. Let it call it an open marketplace. But let's get some competition. Competition breeds winners for the society. They breed winners for the taxpayers. We've got to get the burden off the taxpayers, and let's put the burden back on individuals who really want to work for it. Let's everybody work together on this thing. This is not a you versus me. Everybody needs good health care, but the health care system we have now is flawed. It's just not working right at all, and premiums are going up. And look what it's doing to small business. I've talked to small business owners all over the Tidewater area. They say they're being stopped from growing. They have the 49 employee limit. If they go over 49 employees, then they have to raise everything involving their medical costs, which is going to hamper a small business. They can't hire more people, and how in the world can we support something which is going to damper small business, which is the backbone of our country? This Affordable Care Act's got to go.
Well, yes, it has to go. It's a disaster. We've got now companies that are pulling out of it. But look, Bobby Scott, he said something that I want you to key in on because he's right from his perspective. When Obamacare was started, it was basically a down payment by Barack Obama on his single-payer system. And they knew that this thing would eventually collapse and that they would have to go to a single-payer system because the problems you've got now is, I forget the number, but you've got like 10, 12 million Americans that are now getting insurance that is almost 100% subsidized because the majority of the growth in Obamacare is those that are subsidized. So they're paying either, they're paying nothing at all or they're paying 10% of what everybody else is paying. So, and this is a big number now. It's like 10 million. And the reason Obama did this was to get so many people on it that then the only alternative would be to go to a single-payer system because you're not going to tell 10, 12 million people, okay, you had insurance for a while, and now it's gone, right? Nobody's going to do that. So how do you deal with that?
You deal with that, first of all, by not taxing people for not buying insurance. What's wrong with personal choice? Whatever happened to that? The government is too involved.
But you're not answering my question.
We've got to stop it.
So a Republican that wants to replace Obamacare has to say how they're going to deal with the 10 million people that are now on the Obamacare rolls that are not paying anything, that didn't have insurance, and now they are. These are the people that don't qualify for Medicare because they make over that amount, but they don't make enough money to get insurance. So Obamacare has subsidized it through the tax that you mentioned, Marty, and now they're covered. So the problem is, like any entitlement, here's the problem. So you have this entitlement. That's really what Obamacare is. It's an entitlement to 10 million people. They have insurance. They didn't have it. Now you want to get rid of it. What do you say to them?
I'm not saying let's get rid of the health care. I'm saying let's revamp the system. Let's look at the guidelines. Let's look at the qualifications. Let's look at the threshold of what it is. Medicaid's been around for years and years and years. It's been a viable system for those who could not afford other types of health insurance. The Medicaid program is one we can look at again. Let's say let's raise the level of responsibilities, raise the level of income. Let's just take a look at it. I'm not saying let's take away from health care. We're not going to throw people out in the cold. We've got to re-examine the entire program, reset our standards for it, and make certain people still have health care. We're not going to throw people under the bus. And remember this, every hospital in this country has to provide health care to anybody walking through the door. Mm-hmm. They have to. It's the same thing that's been going on for years and years. Right. What Obamacare has done is put an unfair tax on individuals who had no say-so in that tax at all.
Right.
There was not a vote on that. There was just a carte blanche, the Democratic rule. We're going to pass it. Don't bother reading it. It's going to be good for you. We were all hoodwinked, and the Republicans knew it. The Democrats knew it too, unfortunately. But yet they forced it on us. We've got to have a new system which is going to be viable and fair to everyone.
So why not just go to a single-payer system where everybody pays in, and the government just basically mandates it.
Well, I'd like for everyone to pay in, but still there's some individuals who cannot afford to pay in because they don't make any money. They're on a below poverty level. I would like to see those folks be able to have a good health care system, but the forcing of the tax is bad. The single payer system is one we can look at very strongly. Let's get a good recommendation done. Let's get a good study done on it. Let's get everyone of the economists get together. Let's get the Democrats together. Let's get the Republicans together, and let's work on this together instead of having a dividing rod between us.
All right, that sounds like a reasonable conclusion here. Marty, now let's get to your race with Bobby Scott. I mean, he's run a couple times where he's had competition. He's gotten like 90-something%. What makes you think that now you're going to make this race competitive and interesting?
He's gotten 90% because the district was set up where he was going to win. Because I'll use the word gerrymandering. That's what it was. It was set up to have a African-American district, a predominantly African-American district. And the courts decided this, not me. The courts did that. Now it's been redistricted. The district lines are redrawn to where we've got so many new people in this new 3rd district, including myself, where they're actually going to now have a choice of a candidate who can win. The demographics are changed so much that I believe the latest number I saw was 54% of this district is now Democrat. And that's 4 points from being even between Democrats and Republicans and the independents. So there's a good chance now, and I believe there's a winning chance for someone like myself, a non-politician, a person who has not been in politics before. I'm career law enforcement. I retired from law enforcement in 2001, worked with Chesapeake for 25 years. I'm not the politician that people normally see when they vote for someone. My opponent is a career politician. He's been part of the establishment, been part of the system that broke Congress, has offered no solutions. I'm going to be a problem solver. That's what I did. I was a detective. I knew how to find solutions to problems. I knew how to solve things. This is what I'm going to do when I go to Washington. I'm going to work together with everyone who's concerned just like I am, to make certain that America is going to be back on the path it needs to be on. Well, I'm going to give people a choice. When they go to the ballot box, they're going to see my name up there and say, who is this guy? Wait a minute, I remember hearing about him. This is the guy who's going to change things. This is the guy who's going to bring positive response and solution solving to Congress, because he's going to be open to different ideas, different philosophies, and he's also going to listen. He's the person who's going to actually listen to me, to represent me. I can call him, I can talk to him, and I'm going to be the guy who's going to be there for him. That's why I can win.
All right, you're going to have a lot of opportunities to debate Bobby Scott. He told me that he was open to anything that fit within his schedule, and I believe him. I asked him if I could moderate a debate between the two of you gentlemen, and he said absolutely. He told me to call his staff up, and I'll do that when I get back on Monday and set something up. So I think it's going to be a fun campaign. I think you're going to have lots of opportunity to engage Congressman Scott on the issues, Marty, and based on your background and your qualifications, this ought to be a fun, interesting race. Got a couple of texts I want to read. This from Henry in Virginia Beach. Henry says, regarding Obamacare, just remember Jonathan Gruber. This is from Donna, and Donna says, regarding health care, remember those people who had a choice because of their company, but because of the way the guidelines require the company to pay for full-time employees, created a part-time employee system, so they might have got the insurance, but they lost their full-time status. And then this from Mike in Williamsburg. He says, is Marty a Republican? Yes.
Yes, definitely
Mike,
a Republican.
Marty is a Republican,
yes,
and he's
I'm
running for Congress, and he is a Republican. He's running in the 3rd district, which is right now held by Bobby Scott. We're out of time. I want to thank Marty Williams for being with us. We're live at the Wells Fargo Center, Day 4, DNC Convention. I'll be right back.
Thank you, John.